Something in our classrooms is changing. Look closer and you will see it. Children who are distracted, restless, tired, and sometimes quietly struggling. The after-school time pattern is hard to ignore too. More screen time, unstructured routines, less movement, rising emotional stress. For decades, schools have always seen this as their responsibility, doing their best to support students, teachers, and families. But what we are seeing today is different. It's not just one challenge, it's many, all tied together.
So school mental health has always been in while we envisioned IEC in 1979. That year itself we started working with the regular schools, and from 1982 and 7 years we were working in the municipal schools where we were identifying learning disability in primary and secondary children, and we were also working with the other schools. This is how the journey has been for the past 45 years now.
Specifically in education sector, we have n number of challenges. The one example, my students' attendance is not proper. If you talk about the education, again, my students are not doing regularly studies. Another challenge, my students are not listening their parents. But whatever this problem we are looking for, what is the main reason behind this? That actually we have to find out.
Parents are trying, schools are trying, but too often they work in isolation, creating a gap not of intent, but of connection. Through our work, IEC has focused on building practical support systems around the child. And we've seen even small, consistent changes can make a meaningful difference.
जहाँ पे हम लोग का काम stop होता है, उसके आगे आई से चालू कर देते हैं. So scope is different, and I think it's very helpful for us in past several years. जैसे कि हमारा एक student था, we have seen massive change in that school. Problem जो है वो family से चालू होती है. Case जहाँ पे parents wanted कि वो बच्चे पे changes आ जाए, but even एक पैरामीटर यहाँ पे है कि वो बच्चा क्या कर रहा है, क्या मोबाइल पे देख रहा है, कहाँ जा रहा है, घर पे बता रहा है कि नहीं बता रहा है, स्कूल बंद करके कहीं और जा रहा है. They don't want to publish it. तो अगेन वो बच्चा प्रॉब्लम में जाएगा, अगेन he will in a panic situation and depression. But I guess वो केस है वो इतने अच्छे से IEC ने हैंडल किया है, and we are seeing a lot of change in that school, and I'm very happy.
Support for a child cannot exist in just one space, and it cannot rest within one school alone. What if schools didn't have to navigate this alone? What if they could turn to the people already around them and build a community of care they could count on?
Community of Care is an initiative by Institute for Exceptional Children. After decades of work with families across the city of Mumbai, we have understood that with more things to do in a fast-paced, crowded place like Mumbai, we have very little time. And the easiest is to reach out to people near us. So Community of Care initiative looks at linking the schools, the doctors, the NGOs, the community leaders, people who are looking out to say, how can my area do better? Linking them all together so that together, when we understand what mental health outcomes are, when there is isolation, depression, when there are concerns, when there are family conflicts, we need support from everybody. One person cannot do the job, and so can I reach out. And who do I reach out to? How do we deepen our networks so that we are able to really look out for the child and the family and help them together make best of their potential?
Because when the care comes from the community, children don't just get by. They begin to feel safe enough to grow. Nurturing young minds since 1979. Institute for Exceptional Children.